what can you do to ensure you get the best outcome from this on-call service called midwifery? It's very much like accident and emergency. 1 minute you may have 7 midwives and only 3 mums on the labour ward, and then 5 minutes later there may be 23 mums giving birth with the same number of midwives. Well, improve your knowledge of birth, the birth process, by looking at YouTube videos, reading. Employ the traditional method of shortening birth, opening doors for baby, early on in your pregnancy, starting even at 16 weeks, because then there's no pigmentation of the skin around the birth canal, and it's the first surge of the relaxing hormone of pregnancy. And you can use the help of your man. He helped to make baby. He can do his bit in helping baby out of mum's tummy and not leave it all to mum. Or you can buy the birth trainer, Epi-no Delphine Plus or Aniball. But also follow your instinct during the birth. So I recommend you have a quick browse at female pelvic organs, the ligaments 3D anatomy lion. And 1 second, I'll just move it across here. So if I've got my pen, here we have my pen. This is the urinary bladder, and as you can see, this ligament goes up to the umbilicus, belly button. It's from the upper part of the urinary bladder. There's also a ligament between the urinary bladder and the uterus. These are the round ligaments either side of this is the uterus, with the uterine tubes and little finger-like projections, fimbriae, and that's another uterine tube, and that's the bony pelvis. If we have a look, the uterosacral ligaments between the uterus going around the rectum, the straight part of the large bowel, to the curved part, the last part, the lower part of the spine within the pelvis, called the sacrum. So that's the uterosacral ligaments either side. They help suspend the uterus by anchoring it to the sacrum at the back. There's also a rectum, recto birth canal ligament, or rectovaginal ligament, its old name. This is the birth canal, and this is the uterus sitting into its opening, just coming into the front part of upper part of the birth canal. Here we have further ligaments either side. This is the urinary bladder again. That's the pubic symphysis at the front in cross section. So you can see as the urinary bladder fills, it lifts the uterus. So yes, if you have a very full bladder, it will stop you giving birth. So it's important you go to pass urine every hour when you're on the labour ward. So do ask where the toilets are. So we've got uterosacral ligament, recto birth canal ligaments, and also paracervical either side with parametrium. And these all are responsible for suspending the uterus in its position. So there's the fetal head. We can see baby's head coming into the pelvis. That's pubic symphysis at the front, symphysis, the junction of right and left pubic bones. We have cervical dilatation. Cervix dilates, it widens from 3 mm opening to gradually to 10 centimeters to allow baby's head out, and it's that last 10 centimeters that's the most painful part of birth. So that's cervical dilatation. But before that can happen, this thickness of 1.5 centimeter wall has to get thinned, and that's called effacement. So the cervix effaces and dilates. So dilates means widening of that opening from 3 mm gradually to 10 centimeters, and effacement means thinning of the wall of the uterus from 1.5-2 centimeters almost to 3 mm. So baby's head then passes out from the uterus into the birth canal, and it then, as you can see here, it enters the pelvic inlet which is wider from front to back. There's the front, pubic symphysis at the front, the spine at the back. So the baby looks to the side at that time, and then as it goes deeper into the pelvis to come out of the pelvic outlet, which is between the coccyx, the tip of the lowest part of the spine, and the pubic symphysis at the front, it has to rotate. So then baby faces mum's back, mum's spine. So baby takes up that larger diameter opening from front to back. So initially baby goes in facing left to right, and then baby's head comes out facing towards mum's back. So the longer diameter of the baby's head is between the pubic symphysis and the tip of the spine at the back. But then the shoulders are at 90 degrees to the baby's head. So this is called restitution. So that when the baby's head comes out, gradually the baby turns as the shoulders come into the outlet, pelvic outlet of the pelvis. The baby then faces either mum's left or mum's right. And this is called restitution. Baby's head rotates to look spontaneously, sort of as if by magic, to look to mum's right or left. Well, this is reflecting what is happening inside mum's tummy, which you don't see inside mum's pelvis, that the shoulders are entering the pelvic outlet so that they are coming out with the widest diameter of the outlet from front to back. So we're going to demonstrate that on the model we've got. Here we have children's skeleton. As you can see, the arteries are in red, the veins are in blue. This is the rib cage. The ribs protect the underlying lungs. So if you fall and you knocked yourself, you're bruising your skin against the bone, but there is no bruising of the lungs, so the lungs continue to function and oxygenate the blood, which is what you need them to do. Underneath the breastbone, which is this bit, you have the heart. So the heart is protected by a big thick part of the bone of the rib cage, the sternum. And as you can see here, we have, that's the left lung, and underneath here we have the right lung, and that's the gullet coming down with the esophagus into the stomach where your food is stored, and that's the first part of the large bowel, small bowel, small intestine, and into there this gland that goes from left to right like a carrot shape is called a pancreas, and it secretes enzymes. So here we can see a kidney, that's the left kidney, and the spleen. Spleen is effectively a store for blood and also a filter. So if you have any parasites in the blood, in Africa for example, in low oxygen they deform the red cells by using up oxygen, and then these deformed red cells get trapped in the spleen, so it filters out parasites effectively. And this is your right kidney, as you said, the left kidney. And now we have this pelvis. This all is the pelvis. If I remove that, that's the pelvis. These expansors are the wings, to which the largest muscles in the body, muscles of the buttocks, called the gluteus maximus and minimus, attach, and they stabilize the lower leg. So they're the winged part, or ala, of the pelvis. There's the sacrum at the back, and pubic symphysis at the front, and we sit on tibial ischial tuberosities is what we sit on. And I can see the tip of the spine, it's the coccyx bone at the end of the sacrum. And what we want to note here is that this inlet into the pelvis, if we bring this back into shape, that's the pelvic inlet. It is widest from left to right. From left to right, so the baby comes in either looking to mum's right or mum's left, and then gradually the head has to spiral in order to be able to come out underneath the pubic symphysis, where the opening is widest from front to back. It's more diamond shape between the tip of the coccyx and the pubic symphysis at the front. So from baby being curled up in mum's tummy, effectively taking up the space from the pubic symphysis right up to the rib cage. Entire mum's tummy gets filled by the uterus containing baby. Still confined within this space, baby has to do effectively an escape, like the contortionist. Without straightening out, it has to start becoming, instead of a round ball, it has to become very thin in order to get through that, and it achieves that by gradual spiraling like a corkscrew. So if we take, here we have a model of baby. As you can see from front, baby's forehead front to the back is the wider bit of baby's head, and the shoulders are at 90 degrees. The wider bit of the shoulders from right to left shoulder is at right angles to that of the head. So the baby's head comes in to the bony pelvis, either looking to mum's right, left, or mum's right, and then once, as it goes through the inlet into the pelvis and comes out the pelvic outlet, it has to spiral and rotate so that the back of baby's neck here is pressed against the back of the pubic symphysis, and then the baby's face has to follow the curve of the sacrum. So if we look at the curve of the sacrum here, you can see that it is curved, it is not straight. So baby likewise has to literally do that. So the back of baby's head gets pressed against the pubic symphysis. You see a little bit of baby's head, it's called crowning, and gradually a little bit more, a little bit more, a little bit more, a little bit more, and it's the back of baby's head that comes through first. So a small amount, you see baby's hair, and gradually the opening of the birth canal stretches and then allows baby's head to come out. Once baby's head has come out, it literally sits in that ring, and then you've got to wait. There's no hands on baby, no trying to turn baby. It will turn by itself, either slowly to mum's left or slowly to mum's right, and that's called restitution, as the shoulders then take up that front to spine wider diameter of the pelvic outlet. So yes, in some ways the birth canal is similar to a bird's custard tin in that it's almost 10 centimeter diameter, 9.5 centimeters, but it's not straight, it's curved. So yes, there's the challenge of birth, that baby manages to escape from mum's tummy. If we quickly have a look a little bit on what we've got on the computer now, for a little bit of break from that. So we say it's like a letterbox opening, a tiny opening, but somehow baby's head manages to squeeze through because the cartilage plates override each other because of the fibrous tissue in between them. So there's a letterbox opening. It helps. Here we have Alice in Wonderland scene showing the rabbit running down the hole. That is what effectively the view the baby has as it goes down this curved passage. If we have a look then, so this is Eva's birth. Can't see where the writing is on Eva's birth for some reason. No, it's not. Okay. You can see that she's actually holding her breaths in, deep breath in, holding and pushing. And what we can see here is what we talked about, the crowning. This is top of baby's head, that's the back of baby's head, the top starting to come through. All this from here to around here is actually baby's head, still trapped by the skin. So had she widened with her second birth, it would have speeded this up. This skin here would have gone sideways. So this is the trapdoor muscle, the pelvic floor muscle, and overlying skin. So if we go to the YouTube video now, I'm going to try and find where my cursor is. Found it. There we have Eva's birth. As you can see, she's taking a very deep breath in, and she's held it. She's kept her lips together. There's no moaning, no letting of the air out. And you actually can see this is at the start, and then it's 4 minutes before baby actually exits mum's tummy. So she says here at the front, at the beginning, baby's dad, big sister, my mum and sister all present. My sister did the catching, and the birth took 9 hours in total. And she basically, she thought the baby would come out faster than what it did, in that it took 4 minutes between her taking the camera up and filming and baby actually coming out. So this bit is the bit you can speed up with birth canal widening or opening doors for baby to 10 centimeters, called antenatal perineal massage. So a beautiful birth, recommended to view, in that her sister tries to rotate the baby's head to face left or right, but has resistance and stops. And then the baby herself, without mum needing to push, the shoulders swivel in through the pelvis towards the pelvic outlet of the bony pelvis and take up position so baby looks either to mum's left or right. So a beautiful birth, recommend that you view. That's Eva's birth, unassisted home birth. What more can we say? Going back to very clear for some reason. Birth simulator, limbs and things. So these are the plastic models on which midwives are taught. You can see how stretchy the perineal needs to be to avoid any tearing by the first. The second is a breech birth. Just get my pen again. So this is mum's right leg, left leg, and there's baby's leg, right and left. So baby's coming out bottoms first, baby's coming out head first there. You can see a ventouse cap, a suction cap, being applied to baby's head to help when mum gets a contraction. The uterus pushes, mum pushes, doctor assists by pulling on the cap, the scalp, baby's scalp. Can get bruising on baby's head from the cap, but it usually goes in 3 or 4 days. There we see forceps. Initially, the forceps have to pull down, so the baby's head gets underneath the pubic symphysis, and then you have to follow the curve of the sacrum. So it's a J-shaped, as you can see, the hand is almost horizontal and then becomes more and more vertical. So you pull the baby down underneath the pubic symphysis and then follow the curve and literally lift the baby out of mum's tummy, a reverse J-shaped, which is what Dr. James Yip talks about on his YouTube named Forceps, which is a beautiful forceps delivery to watch. There you can see baby being born by forceps. So that's limbs and things, birth simulator, worth looking at. You need to pause it because it goes quite quickly. The situation that we have in medicine, nothing's perfect in this world, is that the maternal mortality estimation interagency group of the United Nations, it's an estimation because not every country keeps accurate records. They're pleading that by 2030 we eliminate worldwide preventable deaths. Eliminate preventable deaths of mothers, maternal mortality, maternal mortality deaths. And they're asking for immediate action so that it is achieved. Their sustainable developmental goal for 2030 is achieved. So yes, we wouldn't want Great Britain to be on that list who have failed to achieve elimination of preventable deaths. So yep, thank you for doing your bit and promoting opening doors for baby, telling every mum you meet there's some good news. You can avoid tearing, avoid the episiotomy, and shorten birth for your baby, and have a gentler birth on yourself as well. Here we have the Friedman curves, and they were felt to be flawed. 60 years old, based on 500 births. Some of them had twin births. and twins are usually smaller and they deliver more quickly than the average 7-pound single baby, and there was a call for new curves to account for the 7-pound, the 8-pound baby. So that was the thrust of the American Pregnancy Association promoting pregnancy wellness, and they've won 20 hours for a first-time mum to labour before caesarean section and 14 hours for subsequent births. So that's a goal that Great Britain, like every other country in the West, would hope to achieve by 2030. We are a developed country, so if we're expecting it from Africa, then why should we not expect it from the West? Other thing to note is that Royal Radiological Society of North America, some high school players, American football, exhibit measurable brain changes after a single season. Okay, so what we've got here, measurable brain changes after a single season, even in the absence of concussion. So they're not knocked out, don't feel sick, but they have permanent brain changes. They used an advanced MRI technique, diffusion tensor imaging, DTI, which produced measurement called a fractional anisometry, FA, and our study found that players experiencing greater levels of head impact have more FA loss, fractional anisometry loss, compared to players with lower impact exposure. That was Christopher Willow. Similar brain MRI changes have been previously associated with mild traumatic injury. So brain cells are more delicate than we initially thought. We initially think the brain cells of baby are particularly resistant to damage, but it may well not be the case. So shortening birth, avoiding hypoxia, lack of oxygen to baby is a good thing. So definitely recommend doing antenatal perineal massage or birth canal widening. We now look at the Clinical Obstetrics and Gynecology 2010, bleeding after childbirth, postpartum after baby's parted from mum, hemorrhage, bleeding. Postpartum hemorrhage, PPH, is a leading cause of death and morbidity, ill health related to pregnancy. An exhausted uterus, the uterine atony, is a leading cause of postpartum hemorrhage, bleeding. The uterus there's high lactic acid levels in the blood, so it doesn't contract and stay contracted. The uterus is responsible for pushing the baby out, so it's done a lot of work already, and then to peel the placenta away from its inner wall and close off the little shared blood vessels controlling bleeding. So it does a lot of work. So if you can help the uterus so it's not pushing against closed doors, by opening doors for baby to 10 centimeters, you're helping the uterus to stay contracted, avoiding this problem of bleeding. So avoid unnecessary caesarean sections because they're associated with bleeding. You're cutting through muscle, which has a good blood supply. Episiotomies, other genital tract trauma, tearing, could significantly reduce mortality, loss of life of mums, and morbidity from hemorrhage. So that is what the Clinical Obstetrics and Gynecology 2010 advice is. So we're going now. The situation, we're not in a perfect world. 2090. Another one here, that's right. Oh, that's better. We've got it here. So if we look at the Journal of Midwifery and Women's Health, perineal massage, the first trials were written up in 1987, and the abstract concludes perineal massage may be one technique that will decrease the need for episiotomies. So that was the start in 1987. And here we have one of the originals of Epi-no Delphine Plus. Here we see Wilhelm Horkel and the Epi-no story, which I leave you just to pause and then gradually read at your leisure. It says we achieved over 70% intact perineum rates for first-time mothers on this Stenberg clinic. 1999 it went worldwide. There's the prospective randomised multi-centre trial with birth trainer Epi-no for the prevention of perineal trauma, Australia, New Zealand Journal of Obstetrics and Gynecology, and it unfortunately says, following the sample size calculated, we aimed for 450 patients. There was low recruitment. We were only able to randomise 276. Prejudice of midwives and obstetricians against the new device with some factors for low recruitment. So it failed, it was underpowered, and it failed to answer how big a greater benefit is there from birth canal widening to 10 centimetres before the start of the birth. Well, mums can answer it by using perineal massage or opening doors for baby. Cochrane, in its plain language summary, the library of every medical trial ever done worldwide, says open doors for baby, birth canal widened to 10 centimetres. Women should be informed about the benefits of fingertip digital antenatal before birth perineal massage. There's 2000, that went, Epi-no was 1999, Anibal 2013. She was a doula, which is a birth companion. Yana Gordova, the individuals with 6 days training, and the government feels to ensure you have justice, not only do you have an obstetrician willing to do your caesarean section and forceps and episiotomy by your midwife, but a doula that promotes Anibal, and no surprise, Epi-no is also promoted by a doula. So made by an obstetrician, Valheim Horkel, but promoted by doulas. So here you may say, this is 2013, we've got a 24-year-old mum, had a first baby, had a grade 3 tear. So quite a severe tear into the large bowel, but it was a large baby, 8 pound 10 ounce. So had she birth canal widened, it would have decreased her risk of receiving a severe tear into the large bowel. I have another 17-year-old. She gave a smallish birth, small baby, 5 pound 14 ounce, below 7 pound. She had a 4th degree tear extending into the anal canal that required suturing under general anaesthetic in theatre, and she had stretchy skin syndrome, Ehlers-Danlos syndrome type 1. So it's worthwhile doing birth canal widening or antenatal perineal massage to avoid tearing. Tears get infected, and sadly we also have New York, young dad's tragedy, wife dies from flesh-eating infection days after giving birth. I think that was New York 2013, if I remember right. So keep the skin intact so the bacteria can't get in. If we can end, this is another case where the mum lived. This is Canada, that little peninsula, Halifax, Nova Scotia. Lindsay Hubley, 2017, 33-year-old first-time mum, Halifax, Nova Scotia, gives birth on the 2nd, home on the 4th. Clearly, they thought to be a normal birth. And then the day later, on the 5th, she turns up and says, got this sharp lower abdominal pain, stabbing. And she said, oh, it's just constipation, go home. The day after, on the 6th, she gets rushed in and diagnosed with flesh-eating disease, septicemic shock, multi-system organ failure, where she immediately is taken into the operating room. Uterus, both arms, legs are amputated, and she is placed into medically induced coma for pain relief. 6 months on, she is now infection-free, which suggests MRSA, methicillin-resistant Staphylococcus aureus. She's a quadruple amputee awaiting kidney transplant. Her barrister says it could have all been prevented. Hubley's barrister, Raymond Wagner QC, even before it's gone to the court, the newspapers know about it. So, very unusual. According to the Centre of Disease Control and Prevention, the conditions was rare. It occurs when bacteria enter the body through any cut, tear, or open wound. The infection's fast acting. In March 2017, a spokesman for Nova Scotia Health Authority confirmed to the Toronto Star newspaper that province had seen 7 separate cases of necrotizing fasciitis. So I assume she's the only one of the 7 who has been pulled from the jaws of death and lives. But to end on a positive note, we have a letter here from Oxford. Jane Have, the head of midwifery, who replies, there is a link between the massage and the undiagnosed cerebral aneurysm. The length of the expulsive second stage is relevant. So here we have what cerebral aneurysm looks like. If we shorten birth, then the mum's Hartlepool, the mum died 14 hours after the birth of her 6th baby. These babies could be alive. And yes, Britain could have a first if it decreases this very small loss of life of these mothers. 2017, Louisiana, the mum died after the birth of the 4th baby. So 4% of the population have undiagnosed cerebral aneurysms, a little swelling on the brain, blood pressure, pain, which is what you experience in childbirth, all stretch this little balloon gradually more and more with each birth. And if you hadn't stretched that little weakness, the aneurysm here, with the first birth, by shortening it, maybe the mum in Hartlepool would be alive today. So there is the challenge, to get a world first by decreasing the number of mothers that die from cerebral aneurysm and actually produce a world first for Britain.